Bismillah. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Assalamualaikum warahmatullahi wabarakatuh and a very good afternoon. I'll be your Assistant Professor Dr. Tengku Kamil, Deputy Dean of Kuliah of Pharmacy, Professor Dr. Muhammad Izham Ibrahim, the Dean and Professor of Social and Administrative Pharmacy, College of Pharmacy from Qatar University, Professor, Associate Professor, Assistant Professor, staff and fellow students. Today, we will be attending a talk titled Pharmacy Profession, Past, Present, and Future. Are we prepared for the future? From Professor Dr. Muhammad Izham. My name is Nur Safi Arani binti Muhammad Riza. It is my pleasure to be the MC for today's talk. Before we proceed with the talk, it is wise for us to seek blessing for this event. I would like to invite Brother Abdullah Siddiq to recite the dua. Please welcome.
استعدوا بالقراءة الفاتحة. نبدأ بالقراءة. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين. Ya Allah, Ya Rahman, Ya Rahim. In conjunction with this evening talk, we beseech Thee and are grateful towards You in favor of all the infinite blessings to us, Your humble servant, to live in a safe and prosperous life. We seek Your blessing for a flawless progress of this event from the beginning till the end. We seek Your guidance to stay clear of events that will be detrimental to the progress of this event. Ya Zal Jalali wal Ikram, please bless us with Your tawfiq and hidayah. Please guide IIM to greatness, peace, glory, and prosperity in this world and the hereafter. Make us responsible intellectuals. Grant us with valuable knowledge that will be beneficial to mankind in order to gain Your mardatillah. Make us Your righteous servant that follows Your commands and neglects the sinful act. Please forgive us for our wrongdoing. Allahumma ja'al jam'ana hadha jam'an marhuma wa tafarruqana min ba'dihi tafarruqan ma'suma wa la taj'al Allahumma fina wa la ma'ana wa la man yatba'una shakiyan wa la matrudan wa la mahruma. Allahumma ja'al khayri a'malina akhiruhu wa khayra a'malina khawatimuhu wa khayra ayyamina yawma alqaka fihi. اللهم اغفر لنا ذنوبنا وإخواننا الذين سبقونا بالإيمان ولا تجعل في قلوبنا غلا للذين آمنوا ربنا إنك رؤوف رحيم. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. صلى الله على سيدنا محمد وعلى آله وصحبه وبارك وسلم والحمد لله رب العالمين.
Amin, amin, ya Rabbal Alamin. Thank you, Brother Siddiq. May Allah bless us throughout this event. Next, I would like to invite Dr. Tengku Karmila, our Deputy Dean, to deliver her speech along with a brief introduction of Prof. Izham. Please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Our distinguished speaker, Prof. Dr. Muhammad Izham, professors, associate professors, assistant professors, staff of Kuliah of Pharmacy, and our beloved students of Kuliah of Pharmacy. So I would like to welcome you to this talk, which entitles Pharmacy Profession, Past, Present, and Future. Are we prepared for the future? Right? So it is a great pleasure for me to introduce our speaker today, Prof. Dr. Muhammad Izham, who is graduate from with Bachelor of Pharmacy from University Science Malaysia, and and he has obtained his PhD degree in pharmacy administration from Philadelphia College of Pharmacy and Science, Philadelphia, USA in 1995. His extensive career has included his career in University Science of Malaysia. Okay, so there he was a colleague of our Professor Hanuki, right? And also a lecturer to many of your lecturers, which include Dr. Iliadi, Dr. Noni, Dr. Ina, and many others. Thank you. And he also, after he was in USM, he has moved to Qasim University, Al Qasim, Saudi Arabia. Yeah? And currently he is the acting dean and professor in College of Pharmacy, Qatar University. So his contribution to social pharmacy and pharmacy practice has been really huge. So when I was in USM doing my master, he has left USM during that time, but his name was in everyone's mouth during that time. So he was the legend, right? Not the urban legend, but the legend of social pharmacy, right? Okay, so it is so we are really grateful to have him today, and and thankful that he has agreed to spend his time while he is in Malaysia currently. Okay, to come and see you and talk about the pharmacy profession. Okay, so whether you are a first year student just beginning your journey, or a fourth year student preparing to enter the professional world, this lecture promises to provide valuable perspective and inspire thoughtful discussion on our readiness for the future of pharmacy. So without further ado, I would like to welcome Prof. Dr. Muhammad Izham for his talk.
Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon to everyone. Saya orang kecil aja. Saya bukan orang Arab ya, wakil negara Arab. Mungkin awak lagi pandai cakap bahasa Arab daripada saya. Nama pun Universiti Islam Malaysia, patut bahasa Arab. Kan ambil kuliah bahasa Arab kan? By the way, terima kasih Dr. Tengku Kamilah, Dekan kuliah farmasi dan semua ahli keluarga kuliah farmasi. Terima kasih for having me here. My intention is to visit ICOP, but then I was hijacked by these two, my colleague here, one asking me to talk to the faculty, and he has extended it to FAPA. And Dr. Tengku basically would like me to give a talk to the student. Awak jauh sangat. Okay, terima kasih. I can't remember who decided on the topic today, either Dr. Tengku or myself, but I think I accepted it. I think it's very important to talk about our profession, pharmacists. Are we prepared for the future? And I'm not sure whether you're aware the past practice of pharmacy profession, the present that we are experiencing it now, and what will happen in the coming years. In the coming years, bila kita cakap tentang the coming years ni, it is not about, we are talking about next 20 years. While we are talking about the coming future, it's already happening. It's already happening, and we'll talk about it. And it's a pushing factor. It's a pushing factor. Whether we like it or not, we, as the present pharmacists, you will be the future pharmacists, you have to accept it. And whether we are either future pharmacists or the present pharmacists, academia, are ready to accept the challenge. Ini. Okay, this will be the outline of my talk today. Inshallah, I will try to make it because I have another assignment with Prof. Haniki. This will be the outline of my talk to all of you. If you look into the world of today and the future, kita banyak dengar sekarang ini, one of the first thing that I put up, to me, is a concern issues, is the humanitarian crisis. It's a crisis. I'm sure you are aware what's happening in Gaza and Palestine. I'm sure that you are aware of what is happening to the Sudanese people, and many other countries. Issues of natural disaster or human-made disaster. According to United Nations and other NGOs, WHO, for example, as of 2024, it estimates suggest nearly 300 million people globally, roughly 1 in 27, require humanitarian assistance. United Nations Refugee Agency reports over 140 million people are displaced worldwide, making up 1 million of humanity. In this world, we have around 8.4 billion. By now, maybe I already reached 9 billion population, but based on people who died due to COVID-19 and to this crisis, I think the numbers have reduced. According to SDGs, you know what is SDGs, right? Sah, you tahu lah. Bila cakap bahasa Arab ni, sah tu, dia bukan sah lain. Sah, yes lah. Ya. Dah bermain di mulut sekarang ni. Itu aja perkataan Arab yang saya tahu. So SDG 3, it says that ensure healthy lives and promote well-being for all at all ages. And this is one of the main things that we as a pharmacist, in the pharmacy profession, need to target.
Yeah.
So, with this crisis, right, with this crisis, what is the role of pharmacists? Why it is important for me to highlight this crisis, these challenges, issues? Why? Guys, in the front line, kenapa penting? Anyone? Kenapa penting? When we talk about humanitarian crisis, apa pentingnya pharmacist? Come on, student UIA, ke student USM better? No, joking. So, what is the issue? Why is it important for the pharmacy profession? Disaster. Anyone? Yes. Why is it important?
during the time of the disaster, the numbers of victims, patients that need to be gathered by the pharmacists or the healthcare professionals might be increased. Therefore, it will affect the medication supplies, and then it will affect the how to of the liquidity condition and also the facilities, whether it's a large amount of population.
Yeah, so what he's saying is basically medication access. I'm a policy person. I'm not a pharmacy practice. I'm not a clinical pharmacist. So my area is basically policy and economics, epidemiology. So during disaster, whether at war or even earthquake, what is the issue? Road collapse, bridges collapse, people lost their houses, no shelters. What happened to our hospitals? Collapse. Doctors, pharmacists maybe died. So what is the issue? Medication access. People are with injuries or people with chronic medications, they need OTC, need their medications, short of supply. Saya terima telefon daripada Gaza. Yeah, one of the medical school decan called me and said, "Doctor, can you assist us?" One of the requests is, can you accept our students? University collapse. They cannot continue their study. Second request, doctor, can Malaysian, I know that Malaysians are very close to the Palestinian and very helpful. We don't have industries now to supply medications or to manufacture medications, any kind of support. So where are pharmacies during this particular area, particular incidents? Emerging of infectious disease, COVID-19 is another good example. Then MERS, Ebola. How about climate change? Flooding, rains, heavily rain, tempat-tempat yang tidak pernah experience flooding, now flooded, right? So increased burden of non-communicable diseases, cancer, cardiovascular, diabetes are increasing. Life expectancy of many of the people in the countries generally have increased. So life expectancy, if increased, people live longer. People live longer, people have many diseases, chronic diseases. If they have multiple chronic diseases, they need medications, multiple medications. That's the role of pharmacists. Mental health in the digital age, that's another issue. Even though the statistics have showed that the rate of mental illness have decreased, but access to medications for mental illness patients are still at the rise. And with digital age, how can information technology assist in getting information to these individuals? Sometimes they live alone without proper care and so on and so on. So digital age becomes very important. Advancement in medical technology, AI. Ini yang saya katakan tadi. AI, whether you like it or not, is already around us and become advanced every day. Becomes advanced every day. And people are using it, right? So if I mention about AI, what is in your mind? First thing, ChatGPT. Now, we faculty members in all colleges are having headache. How to control and ensure that students do not use ChatGPT cara tak sah atau irresponsible use of ChatGPT. Global health initiative, disease control, immunizations. The role of pharmacists become important during COVID-19. Why? There's not enough in many other countries, pharmacists never basically involved in giving vaccinations to individuals. But because of lack of manpower, kerajaan meminta ahli farmasi untuk tampil ke depan, bantu the other healthcare providers in this issue. They allow pharmacists to immunize and give vaccines to patients. Right. Focus on preventive care becomes more important as time comes into the future. So if you look into the world of pharmacy, it depends on where we stand. So a glimpse into the global perspective, kalau kita lihat kepada rata-rata in this world, if we divide this world into high-income country and low and middle-income countries and poor countries, so it means that where we stand. But the core responsibilities of pharmacists is basically medication access. We talk about it. It's very important to ensure access to medicines. Medication and patient safety. You know that drugs that are basically approved need to be of high quality, safe, and efficacy. And we can add another component or element, it must be cost effective. In terms of expanding roles, population, and people are talking about population and global health. We just talked about it, immunization, for example. How about TB and malaria? The role of pharmacists in TB and malaria, in HIV/AIDS, and patient care. And the scope of practice and education and training, it varies according to the countries and geographical area. These are the variation around the world, depends on where we stand. In the past, pharmacy services were much more focused on product, the medication itself. Apa yang kita buat as a pharmacist? In the past, compounding. We don't have big mass production of medicines. We don't have much, basically, manufacturing companies in the world. We limited patient interaction, no patient-oriented at that particular era. Yeah, giving advice. We are not talking about pharmaceutical care or counseling at that particular era. Focus on traditional remedies. People at that time basically believe, until today, but more in the past, believe in traditional medicines. Culturally and belief have influenced the use of traditional medicines. Less regulations. Even until today, I've visited many countries, especially in low and middle income countries that are my focus areas. Right? I've been to Philippines, I've been going to Mongolia, Sudan, Pakistan, and Yemen, and these countries still are experiencing less regulations. Less regulations. And limited scope of practice, depending on the colleges, education, curriculum, and training. One of the countries that I always visit and train them are in Nepal. I train the Nepalese students and practitioners. The regulations are, I would say, lack of control in terms of policy and regulations, and even the scope of practice are basically way behind. Pharmacists are now taking a more comprehensive approach to patient care at present, with the focus of safety, efficacy, and overall well-being of the individuals. What will be the core services at present? dispensing medication still the core service or activities in pharmacy, among pharmacies, medication management, vaccination in some countries, expanded services, or we call sometimes cognitive services, chronic disease management in many countries by pharmacies, minor ailment management, commonly done by pharmacies, wellness programs, telehealth consultations, expanded prescribing authority. We're talking about now pharmacy prescribing, pharmacy de-prescribing, and online pharmacies. Yeah, online pharmacies becomes now widely, especially in America and other Western countries. Then technology-driven services. Whether we like it or not, it's a push factor. Technology becomes our daily life. Online refills, automated dispensing system, medication adherence program, automation, digital tools, vending machine. Have you seen this in Malaysia or elsewhere? Here in Malaysia? No? Yes? But if you go to Korea, you go to Japan, even in the US, you can see vending machine. This vending machine. You do not need pharmacies, do we? You want a prescription? We have a dispensing prescription items. You want OTC? We have a vending machine for OTC. Jadi apa perlunya pharmacy? Rugi you 4 tahun belajar. Rugi Rugi. You have to have a positive thinking. So if they already have a vending machine, what should we do? We are academia. Yeah, we are faculty members. What should we do? Are we ready for the future? The future, tak payah future, the present ni. Dah ada vending machine. So pharmacies, kalau di kerja is still, they call it pour, lick and stick. You know, pour, label, stick, dispense. I think better buy a vending machine. We don't need the pharmacies. This is another technology. So what will be the future healthcare system look like? Now from girls, ladies, what will be the future of healthcare systems look like? We talk about AI, we talk about automation, we talk about robotics now, surgery, robotics. Do we need doctors, surgeon? So we have to think differently from the past, present. We have to think differently. So the future of pharmacy services is like to see a continuation of the current trends and some exciting new developments. Here is a glimpse into what the crystal ball shows. Saya tak suruh awak jadi tukang tilik haram. Tapi what will be our prediction for the future from what we have seen in today's healthcare system? Personalized medicine and precision medicines. Pharmacogenomics is one of the important areas. So if a college of pharmacy doesn't have an expert in pharmacogenomics, we need one. If a college of pharmacy doesn't have an expert in AI, we need one. Chronic disease management, mental health services, digital health, telepharmacy, artificial intelligence, robotics, right? Robotics, prescribing authority, including de-prescribing, we went, I went, and basically Dr. Haniki also went to the same conference, FIP in Brisbane. So I met one of faculty members, researchers, I think from Queensland University. There's only one study on de-prescribing. I said, what is the, you know what is de-prescribing, right? Do you? De-prescribing? Tak tahu? Okay, your homework. Saya tak boleh bagi kuliah sekarang de-prescribing. So just Google and find out what is de-prescribing. I said, what is the perception of physicians when pharmacy involved in de-prescribing? They are not happy. They are not happy. I can't remember one of the disease that they have started. They have pilot run it with community pharmacies, and they are getting the results, but there is no total exception. I mean, accept level of from physicians. And point of care in terms of diagnostic testing in the patient's unit of blood of urine. So can pharmacists do it, right? In point of care. The future practices will be driven by advancement in healthcare technology, changes in patient care models, and expanding roles in the healthcare system. This will happen. This will happen, right? So the question is, are we ready? Now, some key trends and development that are likely to shape the future practice of pharmacists. We mentioned about the expanded clinical roles. Now, kalau ada pharmacogenomics, we are talking about precision medicines. What will happen to the role of pharmacists? What will happen to the role of pharmacists? What is the advantage of precision medicines and pharmacogenomics? Are you going to learn it maybe in your final year or third year? Integration of technology, is it in the curriculum? And patient-centered care, I think so, is already in the curriculum. Preventive care, regulatory and policy changes with the changes in the healthcare system and services. Do we need more specialized and advanced training pharmacists? Do we need mental health and oncology pharmacists? More specialized. We are not just producing pharmacy or generic pharmacies, but we want pharmacists also to specialize in this area because these are the present and the future services and advancement in clinical and medicines. Pharmacogenomics. So it combines the field of pharmacology, the study of drugs, and genomic, the study of genes and their functions. In Qatar, for example, there are basically a special grant for people who only do in this particular study. Special grants. So there is an encouragement that we are going into this direction. There are special grants in AI, right? Special grants in AI and medicine, just because to encourage people to get into this particular area. Chronic disease management, enhanced collaboration and communication. You have IPE, interprofessional education. Do you? Yes? No? I'm sure yes. So it becomes very important nowadays to have IPE, interprofessional education. What does it mean? We basically, in a simple term, we study together with other professions, right? We have cases and doctors, pharmacists, nurses, work together to resolve this issue. Pharmacists play its role, doctors, we communicate between each other, and so on. Because it's very important to have interprofessional collaboration or care. In the hospital, we want pharmacists, doctors, nurses to work together for a particular patient. So if that is important, we need IPE in the colleges. Global Health Initiative that we have talked about. So pharmacy education varies significantly between high-income and low-income countries due to the differences in resources, infrastructure, and healthcare needs. So if you look into the pharmacy education in high-income countries, it's comprehensive curricula covering clinical, pharmaceutical, and administrative sciences. For each of the point or bullet points, I want you to ponder and reflect whether are you having all this in Kuliah of Pharmacy or not yet, or little for you to judge. Emphasis on clinical pharmacy and patient care, I think it's a yes. Advanced training opportunities, including residencies, fellowships, and specializations. Integration of technology and simulations in training. Access to state-of-the-art laboratories, libraries, and research facilities. Well-established experiential learning sites. Availability of advanced educational tools and digital platforms. High qualified, experienced faculty members. Strong emphasis on research with ample funding and resources. Opportunities for students to engage in cutting-edge research projects. Continuous professional development programs to keep pharmacists updated with latest advancements. Extensive networking opportunities, well-defined and stringent regulatory frameworks ensuring high standards of education and practice, and recognition of pharmacists' role in clinical decision-making and patient care. These are in a high-income country in the colleges of pharmacies. In terms of pharmacy education in low and middle-income countries, curriculum may be more focused on basic pharmaceutical sciences and drug dispensing. Bila saya melawat negara-negara yang sedang membangun, we call it Global South, this is what I have encountered. Lack of clinical pharmacy and practice. If they try to move into clinical pharmacy education and pharmacy practice, they do not have qualified faculty members in that particular area. Lack of resources, tak banyak experiential learning for the students. Limited emphasis on clinical pharmacy and patient care, fewer opportunities for advanced training and specialization. Unfortunate also for them with limited facilities, scarcity of experiential learning sites. You can go to the hospital, you are basically being trained in the community pharmacy, maybe pusat kesihatan, tapi tak berlaku dalam negara-negara poor countries and low and middle income countries. Inadequate educational tools and limited use of technology, shortage of qualified faculty members in the particular area kita nak. Limited funding and resources for research activities. Student mereka tidak ada peluang untuk buat research together with the faculty members. And their curriculum are also very, very weak. Fewer opportunities for students to participate in research, limited CPD programs, fewer opportunities to networking and professional growth, regulatory framework may be less stringent in this country, pharmacists' roles are often limited to drug dispensing and very distributive in nature. You can't find pharmacists in the hospital doing clinical ward rounds and so on. Where do we stand? high income countries or low middle income countries or in between? Mana? In between? Yang mana is lacking? What are the challenges in our country, in Malaysia? What are the challenges? If you say that we are in between. Money? Dr. Niki banyak duit. Lagi, okay. Resources, financial resources are limited. What else? Research? What else? CPD? Maybe CPD is for pharmacists. I'm sure association have programs for CPD, but maybe not for students, but for the practitioners. What else? Think about it, right? What consideration should we take? Students, if you say that you are in between the high income country and low middle income country, you are in between. Tak teruk sangat, tak hebat sangat, kita di tengah-tengah. Sebab apa kita di tengah-tengah? Why can't we have all the best? So one of the things that you mentioned is basically financial resources, research opportunities. So what is your role as a student? There are other challenges, but what is the role of students? What is the role of we as academicians and College of Pharmacy? What is the role of regulatory and policy makers to ensure that our educations are at the best top level? Something for us to brainstorm and think about it. What are the challenges and considerations? Kalau the practice advancement of pharmacy will change, now the issue is for pharmacies, the question will be, what will we be reimbursed? You know what is reimbursement? So kalau pharmacies menjalankan services, memberikan services kepada klien dan customers, patients, what will be in return for the pharmacies? How much can they charge? Who will pay? So this is research by itself. The reimbursement model, what is best and how? Kita nak cakap pasal reimbursement model, dispensing separation, daripada saya belum masuk pharmacy school, dalam 70-an dibincang, sekarang tahun 2024, Presiden MPS, I think dah bertukar tangan, banyak tukar tangan dah. Jadi masalah masih tak dapat diselesaikan. How about data privacy and security? If we use AI, digital health, what will happen to the data privacy and security? Collaboration and other healthcare providers, IPC. If you have IPE, so we must ensure that this IPC also will happen in the hospitals and also outside the hospitals, between community pharmacy and the GPs, doctors in the hospitals, pharmacies, and also nurses and other professions in the hospitals. We need to collaborate. We call it IPC, interprofessional collaboration and care for the patient. Revisit the pharmacy curriculum. We need to revise, enhance. We need to revise and enhance. To conduct research, outcome research, and impact study on the issue that we have discussed. Reimbursement model, for example, is one of the issues. If someone can do a research on that, what would be the best model for pharmacies in this country? How about infrastructure and infrastructure? Do we have all the infrastructure equipped in our colleges? How about method of teaching and technology used? Right? Masa saya baru balik daripada US, pada zaman itu, kita dah mula guna slide dalam, bukan slide, panggil apa, carousel. But still, our faculty members still used chalk. Chalk and kita panggil blackboard, tapi warna dia hijau kan. So green board lah, bukan blackboard. Dengan chalk. Tak payahlah sebut nama siapa pencarah tu, tapi guna chalk. Ada yang guna transparency, sampai kuning transparency tu. You kalau simpan lama, you guna bertahun-tahun, you guna transparency. Sekarang mungkin tak tahulah ada pencarah guna transparency atau tidak. Kuning transparency tu. Jadi maksudnya tak berubah lah. Dia tak pernah tukar dia punya transparency. Berzaman-zaman. Lepas tu kita guna carousel. Tu obsolete. Now everything guna technology. Kita kata, okay good, we are using it. But remember, there are countries do not have this technology. Do not have this technology. Encouraging faculty exchanges and collaboration with other institutions. Mungkin there is opportunity between Kuliah of Pharmacy UIA dengan Qatar University. Maybe with UK or other countries. We do, from Qatar University, we do send students, for example, to New Zealand, to North America for experiential learning. Today, my visit to ICOP, because I want to send my students to UIA ICOP, right, for training. So this kind of collaboration and networking. Need to improve laboratory and research facilities. Provide students with more research opportunities. And involve students in scholarly activities and publication. I'm not sure the opportunity here, but in Qatar University, students do research. We provide 10,000 riyal per project, 20,000 riyal for a master's and PhD student. That's one grant, research grant. And output from this research, we publish together between student and faculty member in quality journal. So these are the training that we give to students and opportunity to the students. Establishing more experiential learning sites. My visits today is to expand, because manufacturing companies in Qatar are still at the infancy era. We don't have many. 95% of the drugs in Qatar are basically imported drugs. So it's not good. It's not good. Even though Qatar is rich, but it's not a sustainable approach. Partnering with international organization, institution to share resources, knowledge, and best practices. Kalau ada consortium between colleges of pharmacy. Participating in global health initiative, right? Are we, or are you prepared for the future? Yes, no? So the answer is no. Reflect. What is your role as a student to be the future of a pharmacy profession? What is our role as academician? And what is the role of regulatory and policymakers in pharmacy in this country? Thank you very much. Kalau ada soalan, nak bersoalan?
Thank you, Prof. Izham, for your amazing discourse just now. And now I will open the floor for Q&A session.
Ada soalan?
Any questions, students? Ready? Okay.
I just wanted to ask, we have the opportunity to pursue our job as a pharmacist overseas, like maybe another country to like for example in the US or maybe in something like that. Okay, that's all. Thank you.
An easy answer is yes, but with condition. For example, depending on the country that where you want to go. Every country have its own licensing board. Every country have its own requirement, right? And exams. Even though you dah ambil forensic, you dah buat housemanship, dah settled in Malaysia, you can work and you serve the country for national service, whatever. But that is for Malaysia. If you want to travel abroad and work elsewhere, number one, persoalannya adalah apakah these universities, curriculum and UIA, for example, but public university in general in Malaysia, recognized by that country, right? So if it is recognized, satu masalah selesai. Soalan kedua, then you need, if you want to work in that particular country, licensing issues, dan maybe exams, right? That is a few things. So for example, if you want to work in Qatar, Qatar tak payah ada forensic exam, but kita ada prometric exam. Prometric exam is a combination of pharmacology, all the subject yang you belajar, and plus the practice cases, right? You have to pass that exam. Tak payah ada residency dan sebagainya, housemanship. You only pass that exam. So they recognize our education here. You do the exams, and you can start working if you are accepted. But if you go to other countries, US, UK, they have their own requirements. You can. So usually Malaysian universities, public universities, pharmacists are acceptable. Right? But you have to fulfill the requirement of that country. Kenapa? Dah berfikir panjang, gaji kat sini rendah ke, tak cukup ke? Any other question? Yes.
How is the curriculum in Qatar, pharmacy curriculum in Qatar? And what is the difference in Malaysia?
Saya datang sini hari tu, I think last 3-4 years ago. I can't remember the exact curriculum. Easy is we are the Canadian, under the Canadian accreditation body. It's called CCAP, right? We follow the North American and especially the Canadian education system. And that's why we are accredited under the CCAP Canadian. Saya tak pasti sama ada apakah perbezaan dia, ya, perbezaannya. Are you an integrated system, modular, integrated like USM? During my time is you learn pharmacology, you learn physiology, chemistry, asing-asing, yeah. But in year 2000, we integrate. It becomes a modular based on organ system. Year 2000, USM. Qatar University, baru last year we started. We just started last year, the integrated or we call modular. So all this while we are basically a traditional model of, in terms of, but I'm sure there are vast difference of curriculum in Qatar and Malaysian local universities. I'm not comparing with UIA, but remembering what we have gone through, quite different, quite different. Our emphasis on research and research methodology and statistics starting from year 1. Year 1 ada, year 2 ada, year 3 ada, year 4 ada. Right? Experiential learning, bias sama aja in terms of experiential learning because it's very important. I'm sure that UIA, USM all have the experiential learning. What is the difference is maybe Qatar are willing to send their students abroad. So we do send students to America, America, Canada, UK, New Zealand. Even we are going to send to Malaysia for training. So we do support, we have a budget and we do support students, but only selected students who have good GPA, good behavior and attitude, good profile, baru kita hantar keluar negara. Right? Jadi ada perbezaan, tapi based on learning outcomes and program learning outcomes, yeah. What else? Yeah. Any other question? Tak ada? So, Cik Pengurusi, silakan.
No more questions.
Terima kasih.
Okay. With the final answer provided by our Prof just now, it remarks the end of our talk today. I would like to apologize for any shortcomings throughout this event. Thank you everyone for attending this event. We also would like to take this opportunity to thank Professor Izham, Dr. Carmela, lecturers, staff and students for your cooperation throughout this event. I hope all of us will make use of today's knowledge for the better future of us. Now, let's close our ceremony with Tasbih Kafara as well as. Before dispersing, we will have a short photography section.